Minnesota ranks in the bottom third among states nationwide for the number of supermarkets per capita. Not surprisingly, most of the supermarkets that do exist in Minnesota are located in higher income communities. People who live in communities without a local grocery store selling healthy and affordable foods suffer from higher rates of obesity, diabetes, and other diet-related health problems. A recent report by the Food Trust, a nationally recognized nonprofit, found that nearly 900,000 Minnesota residents, including over 200,000 children, live in lower income communities underserved by supermarkets. Obviously, this is a public health problem that requires some attention. We'll be providing some of that attention on today's episode of A Public Health Journal. Please stay tuned.
Welcome to A Public Health Journal, a program that explores public health issues facing our society today and tomorrow. The host of the show is Dr. Ed Ellinger, Commissioner of Health for the state of Minnesota. A Public Health Journal is sponsored by the Minnesota Department of Health and the Hennepin County Human Services and Public Health Department, all working together towards the goal of healthy people living in healthy communities.
Welcome to A Public Health Journal. Today we're going to look at how the presence of grocery stores in communities contributes to improved health. We'll also look at some of the reasons why some communities don't have access to grocery stores and what can be done to address that problem. Joining us in that discussion are Dr. Melissa Laska, Associate Professor in the University of Minnesota School of Public Health, and Glenn Ford, CEO and founder of Praxis Marketplace. Dr. Laska is an expert on the environmental, social, and behavioral determinants of obesity, and Mr. Ford is a former corporate executive for PepsiCo and Baxter Healthcare who searched for years to find ways to give back to urban communities. He discovered the best method was through improving access to food. Both were members of a grocery store access task force that came together to explore how to improve access to grocery stores in every community. Welcome to our program, both of you.
Good to be here.
Thank you.
We've been hearing a lot about access to food. We've been hearing a lot about food deserts, and you come at it from a couple of different approaches. Melissa, why are you interested in access to food from your academic perspective?
From my perspective, I think it's most interesting to think about these food access issues framed in the context of health disparities, in that a lot of the things that we care about as a public health practitioner or a public health researcher, a lot of the disease outcomes that we see, we really observe some really striking health disparities around those things. So for example, with obesity, we observe that African American communities and Mexican American communities are much more likely to see higher rates of obesity than Caucasian communities. And we also see striking disparities by socioeconomic status, particularly within specific racial and ethnic groups. And so we think that there may be something in the neighborhoods that we live in and the communities that we've built up around us that really kind of underlie some of those disparities. And food access, healthy food access, may be one of those things.
Glenn, how about you? What brings you to this topic?
Well, supermarkets have a huge role to play in communities beyond simply the purveyance of food. First of all, they are great employment opportunities if people stick with it for a while. We all know that on the very lowest end that's not a great salary, but grocery stores are actually the #1 industry segment if you don't have a college degree that you can possibly work yourself into. The store manager actually makes a nice six-figure salary. So I also look at it from the economic impact, because if you are a believer of the social determinants of health, which I am and which I'm sure you are as well, that I can't truly care about your health if I don't care about your economic conditions as well.
Mm-hmm. Well, yeah, and we talk about health in all policies.
Correct.
There's health in education, there's health in transportation, there's health in the business community, and all of those contribute. Mm-hmm. So I know the two of you have been part of the Minnesota Grocery Access Task Force. Melissa, could you tell me about that task force, how it came about?
Sure. The task force was originally convened by the Food Trust, which is a nonprofit organization that is based out of Philadelphia, but has done a lot of work around the country in different states and different cities, and in Philadelphia, to move this issue of food access and other healthy eating issues forward. And so they convened this group of people and experts that represent a wide range of expertise to kind of come together and talk about Minnesota-specific issues and what we need to do in Minnesota and how we need to kind of frame our priorities in Minnesota in addressing access to healthy foods.
Glenn, how did you get engaged with the task force?
Believe it or not, I was actually invited by another grocer. who informed the task force that I should be on that committee as well, and so I joined it and was happy to be there.
Now, I'm assuming that with most task forces, you sort of looked at the needs. What were some of the problems that you identified as part of the task force? Glenn? Or?
You know, actually, one of the biggest issues that I think inner cities suffer from sometimes is because they have lower median incomes, that people don't feel like there is enough income there to support a grocery store. And that's anything but true. While sometimes they don't have as high of a median income, let's say North Minneapolis does not have as high a median income as Eden Prairie. Let's take a real life situation. If I looked at an area around Eden Prairie, there'd be 7 grocery stores and they're all chasing that median income for, let's say, $56,000. You'd find that that median income is so competitive that it is actually less competitive than going into some of our inner city areas. And so I don't think that we really think through those problems very well. And then there's also this misconception that the theft rates, or shrink as it's called, in the inner city areas is a problem, and yet there's only a 1% difference between the shrink level in an inner city and in a suburban area. And so it's something that the hype, if you will, behind it is far different than the reality.
Now, you talked about we don't think about this issue. When you talk about we, are you talking about the grocery store owners, the supermarket chain owners, public policy makers, local officials? Who are you talking about?
It's a very good question, and that we represents people who care. And that should include all of those groups that you just mentioned. It should be policy, it should be community activists, it should be anyone who cares about this issue, because those health issues that she stated just earlier, that impacts all of us. And as much as we'd like to think that we can compartmentalize who we are, I don't think that we can. When the health, when insurance rates go up for health, it impacts everyone. So we're in it together whether we realize it or not.
Melissa, from your perspective, what were some of the findings on this task force?
Well, I think Glenn brought up some really important points. Just building on those, it seemed to me one of the big take-home messages was getting over that initial hurdle of getting stores into some of these communities. So getting past the startup costs, getting past the kind of initial development phase, and then getting them to realize that these are kind of real situations where they could make money and be sustainable and serve the community in a successful way. Another thing that came up a lot on the task force is thinking about our urban city communities that are underserved, also thinking about kind of outstate and thinking about our rural communities that are really lacking in grocery stores. And what are the similarities and recommendations that we can make between addressing those two communities, and are there differences, and how do we think forward on those issues?
And we were talking about health and all policies. Who was involved in this task force? What were sort of the general areas that people came from to bring the different perspectives?
Yeah, well, you had several of the local grocers, and you had other grocers that might consider Minneapolis. You had academics. You had some people from the finance community as well. You had economic development people. So I mean, you had a pretty well-rounded group. I don't remember if we had very many public officials there. I don't, but I think you easily at any meeting had 20 to 25 people there.
Okay, good. Well, I want to talk about the recommendations that came out of the task force, but first we need to take a little break.
Sure.
We'll be back right after this message.
There's a crisis in America. More than half of us are overweight. The advice experts agree on is to eat more fruits and vegetables as part of a healthy diet and be physically active. Eating 5 to 9 servings of colorful fruits and vegetables and being active every day will help our kids stay healthy and fit. Eat smarter, be active, and get healthy, America. Because the figures don't lie.
welcome back. We're talking about access to grocery stores in urban communities and in rural communities with Dr. Melissa Laska and Glenn Ford, who are members of the Grocery Access Task Force. I know and I have in front of me actually the 8 recommendations that came out of the task force, which is now, what, a year or so ago that the task force? What were some of the things that were really highlights of recommendations that you could see were really something that could be implemented in the near future? Glenn?
I think one of the things that we ask is for some of our public officials and some of the methodologies for financing would actually be a lot closer to the realities that business people such as myself have in trying to go out to the marketplace and attract capital to these projects, which can be a challenge. I mean, people don't think of grocery stores as a as an investment that is as exciting as, say, technology. When in actuality, managed well, it could be a pretty good investment. So there's definitely a request for there to be a tie-in between public policy and the actual financing of a grocery store, and I would say that's one of the top ones.
Melissa, what did you see coming out of this, things that really could make a difference in access to food?
There were also, building on the financial aspect, there were also recommendations around regulatory issues and how to kind of streamline the regulatory process so that it's easier and more straightforward for store owners and businesses and chains to come into these kind of areas. There were recommendations around transportation considerations, so to make sure that as we're considering new sites for businesses, that people can actually get to those sites, not necessarily just by cars, but with other means of transportation. One of the things that I think is really interesting about this task force and the recommendations that came out of it, and is different from other similar task force that have been built around the country, is our recommendation around small food retailers. So recognizing that supermarkets are important and large stores are really important, but it's also really important to invest in small retailers, that we may have businesses that are already in operation in some of these communities that may not be able to provide healthy food access in the same way that they could if they had some financial supports or other types of supports in place. So those kinds of things are places like corner stores or small convenience stores that may be able to provide healthy staple foods as well. Mobile vendors, alternative models of stores like co-ops. I think in Minnesota we really value both large business as well as small business, and that was something really unique that came out of this group that I don't know that we've seen many other places in the country with these kinds of recommendations.
Well, I know corner stores often take a lot of heat for providing bad food and not having availability, and which brings up the issue of affordability. I mean, you can have healthy foods, but if people can't afford it, it's not going to be accessed. People aren't going to buy it. So how did you get at that? How are you going to make a corner store have an economic model that actually works and that says I can sell green peppers and apples and make money doing it?
Yeah, well, what bad packaged food allows you to do is it allows you to not be as attentive as fresh food would, because I can put a chip on a shelf and it can sit there for a couple months and no problem. Well, that's not going to happen with an apple, and that's not going to happen with with fresh produce. So there's methodologies to make them a lot more effective than they really are. But we also have to be pretty realistic that the margins that are available to some of those corner stores and the business models that they are established to produce are in opposition to a lot of what we want to do from a health perspective. So there are going to be some challenges there, and then the footprints of some of those stores would actually have to be enlarged in some other areas in order to make them do that. Now, would that be good public policy to assist them in doing that? Well, from a health standpoint, if we looked at our cost of what we're paying on the health side, it absolutely would be. But again, that's a comprehensive set of thoughts, and that's not where, sometimes as a country, we're not real good at that.
Yeah. Well, and as I look at the recommendations that came out of the task force, there were several that really said the state should, the city should, local community should, sort of the public side, and then there was what's going to happen on the grocery side. So what is the role of government, federal, state, local government in making access to food a priority and affordable?
Well, I do believe they have a role, and I do know that it could be quite contentious when we sometimes say, what is the city and the state's role in in business. But quite frankly, when I look at the cost of building a baseball stadium and a whole host of those other kinds of issues, and I compare that to the number of small businesses that could be created for that kind of capital, and then to watch the exponential effect that that could have if we were to be a little bit more forward thinking that way, it could be astounding. And the number of jobs that could be created would be great. And that's the piece that, by the way, I maybe take the biggest exception to, that we aren't focused on the job creation side of it. Because I can put a great store inside of a community, but if no one has a job in that community, how do they buy the food? Mm-hmm. Right, so I think that the city and state working in conjunction with people around food can create a whole lot of those jobs. As an example, not a lot of people would realize that in North Minneapolis alone, there's 170 small entities that can sell food. So if we worked collaboratively and where we used some of the infrastructure, city and state, to now help build upon that, there's a whole lot of power to be able to increase that economic base that sits in that area.
Okay. And Melissa, I'm going to ask you about the grocery store side, because you're flipping I was expecting to answer that. So what do you see? What was the recommendations for grocery stores?
So the recommendations for grocery stores, I think are, I'm trying to recall back to what the recommendations were exactly, to kind of come together, and a lot of the recommendations were around thinking collectively and thinking kind of in a futuristic type of way, realizing that these recommendations aren't just standing kind of as is, that we need to continue this discussion and continue this group, both with the private and the public sector, to realize that the private sector needs to support the public sector in kind of moving forward on some of these things.
So I know really, some of the things where it was, how viable small and alternative retail distribution models are there. And that was the question, can some of the larger chains actually partner with some of the smaller stores?
Well, they could. I have a wonderful relationship with SuperValue, corporation as a wholesaler. And so yes, there are these relationships that have to coexist. And that we should encourage. And the other part that I wanted to get back to on the city and the state part, very few grocery stores in this country are actually built anymore without some form of city or state involvement. I don't know if very many people know that, whether that's being done by new market tax credits or whether that's going to be TIF dollars or some other form of incentive. So it is a very close connection that should be involved. And that's including some of our largest corporations in this country. I won't name the largest one, that they're at the city and state looking for the incentive to put a store in an area as well.
Okay, good. Well, I want to talk about sort of next steps from this and look sort of blue sky, what do we want to do down the road, but we need to take a little break first. Great. We'll be back right after this message.
$23 million Americans are obese or overweight. These people risk health problems such as heart disease, diabetes, stroke, and cancer. The cost? More than $14 billion a year. They deserve a healthy start in life. To learn how you can help, visit obesityaction.org. That's obesityaction.org.
Welcome back. We're talking about the Grocery Store Access Project in Minnesota with Dr. Melissa Laska and Glenn Ford, who are members of the Grocery Store Access Task Force. So since you had this report that came out a year or so ago, what has happened? Has there been any progress made in addressing some of the issues that were raised by the task force?
Well, I continue to move forward with the building of our store. We actually have a site on Plymouth and Penn. And we
should just back up a little bit.
Yes.
Tell us a little, your Praxis Marketplace.
Yes.
Tell us a little bit about that first. So.
Yes, and that's a 30,000 square foot grocery store that we're going to put on the corner of Plymouth and Penn. But we are, our overall vision is to build 200 of these stores around the country. So we have been active in 16 different cities, and we have active projects in 4 cities, all of them a lot larger than Minneapolis, and Minneapolis sometimes being our most challenging one, because we're trying to fit ourselves into a specific space, right where it's very convenient for people, dealing with issues such as the ability to walk to a store as opposed to driving. So we have our hands full, but that's a part of what we're doing.
Okay. Melissa, what do you see has happened since this task force?
Well, there's been some other work specifically around the small retailer piece. The city of Minneapolis, for example, has continued their Minneapolis Healthy Corner Store program that's meant to work with small retailers, particularly small corner stores, in stocking healthy food, addressing some of the distribution issues, some of the management issues, and what does it take to have healthy foods in your store, and how do you maintain stock, and where do you get it, and all of those kinds of issues. And so we've seen that really move forward, and we're hoping that there are some exciting new steps in the future.
Are there any connections between local stores, corner stores, and some of the programs like WIC? The supplemental food program for women, infants, and children, which really gives people access to food and electronic benefit transfers and how to use those kinds of things. Has there been progress in those areas?
So there have over the past several years, I would say, not necessarily in the last year, but a lot of our small stores in Minneapolis, at least, are WIC partnered and do participate in the WIC program. And through a series of changes that happened to the national WIC program in 2009. We now have minimum stocking requirements for a series of healthy foods for small corner stores that are participating in WIC. So they've had to receive technical assistance and figure out some of these issues on their own, and we're hoping that that message can kind of translate to other stores that aren't participating in WIC, and small stores can help other small stores figure out some of these challenges that maybe they've already been through because of the WIC changes.
And have the larger supermarkets started to pay closer attention? Because you had mentioned early on, there really is a market there. Have they started changing their practices either in Minnesota or elsewhere?
Maybe not aggressively enough. Quite frankly, I formed Praxis because it was too difficult trying to convince some of these larger stores to go into some of these areas. And I guess there's a side of it that sometimes I understand, but there's another side of it that I almost find offensive. But the side of it that I understand is that they step in front of investors and they ask for millions of dollars to create a store, and they have an opportunity to put one in North Minneapolis, or they have an opportunity to put one in Minnetonka. That investor is probably a lot more comfortable with Minnetonka than they might be in North Minneapolis. So I understand some of those pieces, but then beyond that, however, there is this huge opportunity, and the ways that we promote the activities that are going on in some of these areas, and we really have to be careful how we communicate them. They are not helpless. They need investment, just like any other community does, but they're not helpless communities. And I think sometimes we overdo the state of disrepair in some of those areas. Yeah. We do them a disservice.
Right. And Melissa, you had brought up earlier what's going on in rural communities. Again, this is another huge issue. Again, lack of access to really low-priced food. What's going on in that area? Do you know?
I have to say I'm not particularly engaged in the rural community issue, but I think they're continuing to have dialogue around these issues. Again, I want to emphasize that this task force and the recommendations that came out from the task force were really just seen as kind of the first step, and that we're not we haven't launched with a series of recommendations that are necessarily ready to hit the ground running. There's a lot of continued dialogue, a lot of continued planning and continued work that really needs to happen. And so my hope is that we can have a continued kind of task force-like discussion as we develop these recommendations further. And there might be a second set of recommendations and a third set of recommendations that really refine some of these issues. They need some refining.
Certainly in my experience in working in public health, when communities actually say, this is an issue that we want to address, and they understand the issue, things really happen. Do you think people really understand the connection, average public, understand the connection between access to healthy foods and their own individual personal health? And how do we educate them, and how do we get them engaged to say, yeah, we want to have something happen in our community?
I think they understand the issue of health and how healthy foods might be good for their overall health. I think the piece that they really miss is they don't understand how important it is to have that store in your community for the jobs that it might create, that then puts more income into their communities, which then has the opportunity to bring both resources and a whole host of those other social determinants of health upwards. So I think that that's the part that's missing. That to have too singular discussion on just the store, as opposed to the power of the store to create, that there needs to be far more conversations along that vein.
I totally agree. I think bringing in some of these other outcomes, these other positive things that can happen from grocery store development is really important. And I also think as we see models around the country of other businesses that have really done this through public support, through some public financing, but then have become self-sustaining and really profitable and really a great benefit to the community, I think that can be particularly inspiring and give a lot of assurance that, hey, we need to move forward with these issues here too.
All right. In the last 45 seconds that we have, what's the one thing that you would like to see happen within the next year to really improve access to healthy foods? Melissa?
I think we need to continue discussion. I think the worst thing we could do is just stop right here and decide to go into action mode. We have too many different people coming from different areas that need to consider that collective and comprehensive discussion and moving forward.
Well, in the next year, the opening of my store in Plymouth and Penn, but then number two, it would then also be the opportunity to collaborate around a whole host of these issues. So, whether that's speaking with someone like Melissa, because this whole issue of obesity is not going to go away just because you put the store there. The store is one step and probably 6 or 7 steps that actually needs to be done. And so if we're going to do a good job with that, we're going to need a lot of help.
Yeah, these are all complex issues.
Yes.
Require all of us.
Yes.
Public health is what we as a society do collectively.
That's correct.
And this is part of the conversation. This has been fascinating. Thanks for being with us.
Thank you very much.
Thank you.
And I'll be back with a closing comment right after this message.
The big guy comes up to bat, hitting .342 with 92 RBIs and 36 home runs.
Chill raw and prepared foods promptly. 1 in 6 Americans will get sick from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
Over 23 million Americans, including 6.5 million children, live in food deserts, places where there isn't a supermarket within a mile. That means people living in those areas are without ready access to fresh, healthy, and affordable foods. These food deserts are usually in low-income areas. The effects of food deserts are devastating. They contribute to obesity and other diet-related illnesses. They force families living in these areas to use valuable time traveling to neighboring areas. And if you don't own a car, gaining access to good food is even more difficult. But just as problematic as food deserts are food swamps, places where fresh and healthy foods are available, but they are swamped by cheap, unhealthy, and highly marketed foods that overwhelm even the most dedicated and conscientious shopper. If we are to assure access to healthy foods for everyone, we will need to find ways to make healthy foods not only available, but affordable. Implementing the recommendations from the Minnesota Grocery Task Force would be a great first step. We will also need to reduce or counter the massive advertising for food that is not healthy. In other words, we need to plant trees in the desert and drain the swamp so we can make the healthy eating choice the easy choice. That's all for today. Thanks for watching. I hope you can join us again next time on A Public Health Journal.